Hello everyone, my name is Jada Fisher and this is my project on Alzheimer's disease. So what is exactly Alzheimer's? Alzheimer's is a kind of dementia that causes problems with memory, thinking, and behavior. The diagnosis of Alzheimer's requires clinical evidence of memory loss and impairment of at least one other cognitive domain. Alzheimer's was founded in 1906 by Alois Alzheimer's, and the first case study of AD was done on 51-year-old woman Augusta D. She had an unusual disease of the cerebral cortex. There is no cause of Alzheimer's, but researchers say there are many risk factors that could lead to having AD. Age is by far the single most greatest risk factor of Alzheimer's. After the age of 65 years old, the chance of getting Alzheimer's immensely increases. Some other risk factors include genetics, so what you inherit, the level of education, and even head trauma. Examples of this could be playing football from adolescence to adulthood. 1 out of 3 people develop Alzheimer's, affecting over 5 million people in the United States. Symptoms of Alzheimer's include aphasia, apraxia, agnosia, and the loss of the ability to do everyday normal activities. Aphasia is the loss of ability to express speech and comprehend it. An example of this is being on the phone with your husband and not being able to understand what he's saying. Apraxia is the loss of ability to do complex tasks involving muscle coordination, such as bathing and clothing yourself. Agnosia is the loss of ability to recognize and use familiar objects. Example of this is how to dress yourself for the correct season. And the last cognitive function is the loss of ability to plan, organize, and do normal activities, such as shopping, driving, etc. Amyloid plaques are found outside the neuron, which means that they are extracellular. These occur when the protein beta amyloid gathers to form sticky, hard, insoluble plaques. Beta amyloid is a type of protein that's sliced from an amyloid precursor protein, also known as APP. These plaques trigger inflammation and create damage to the neurons. This happens when beta amyloid gets stuck in the synapse, causing a disruption, making cells not being able to communicate. If cells do not communicate, they begin to lose connections, causing apoptosis, which is cell death. Neurofibrillary tangles are twists of tau protein that lead to unwanted tangles inside the neuron. This happens when tau separates from the microtubule, causing strands of the protein to fall apart and tangle up. This then destroys the neuron, leaving it to disconnect and die. Alzheimer's usually starts in the hippocampus. On the picture on the top left, the blue highlighted part is the hippocampus. This is essential for forming new memories, and this is why most AD patients usually see short-term memory as one of the first set of symptoms. Under that picture, those are pictures of the neurofibrillary tangles and the amyloid plaques. Beta amyloid, which is found in the plaques, hyperphosphorylates the tau protein, which is found in the neurofibrillary tangles. The picture on the right, on the top corner, there is a healthy brain, and right next to it is a brain with someone who suffers with severe Alzheimer's. Under that is a picture of both of them together, and it shows the shrinkage between the healthy brain and the severe Alzheimer's brain. The loss of neurons causes the cortex to shrink, which then leads to the loss of the other cognitive functions. There is unfortunately no cure for Alzheimer's, but there are some things that you can do to prevent the risk of having it. Examples like reading, doing physical activity, healthy diet, things of that sort. Thank you for watching my presentation. I hope you learned something from it. my works cited will be presented right after this. Thank you.